Okay, friends, so we've created right now basically a pretty decent triangular flap. Now we can, I like to extend it past this caudal root if possible. So just do our kind of our wiggle. And you can make this flap pretty big. The other thing you can do if you want to is you can take this triangular flap. If you want some better exposure, we can do a pedicle flap. So essentially you kind of start where that intersection between the two teeth and you're going to angle. And we want this flap to have a wider base than we do at the top. We don't want to put it on this sort of angle because that's going to have a smaller base. And that's just to preserve as much blood supply to this tissue here. So we're going to just make our incision there. There we go. Make sure that it's going to have to go in a little bit. And there we go. And now we've created a pedicle flap instead of a triangular flap. All right, so now we have great exposure, and that's what we really want, is this exposure, so that we can have a really good look, see where that bifurcation is. I suspect in this tooth especially, you're going to find that this rostral root is really quite big, and you're going to find most cases it is about 60 to 70% of the tooth, and then this caudal root is a little bit smaller, that 30 to 40%. However, you will find, especially if I like Shih Tzus, some of these smaller poodles, Yorkies, sometimes they are a 50-50. So that's why it's important that we get our flap so we can now burr off some of this bone. And have a really good look and see exactly where that bifurcation is. Also, your pre-op x-rays are going to give you a pretty good idea as well of where that bifurcation lies. All right, so now we're going to get our hand piece and our, this is our round burr, and we're going to get that in place. All right, and then what we're going to do is we're going to come and we're going to lightly go along and just really paint off this bone off of the root. Let's see if we can do that. And notice I'm not going very deep. I'm just taking a little bit and go over here. Have this flap was already created, but if we were creating the flap, I actually probably would have made this pedicle flap go down in this area so that I got some better exposure on this more rostral root, but we're gonna reflect that. See, just very lightly back and forth, not taking off too much. And I'm just getting an idea of where are my roots. Oh, and I'm getting a subtle hint of this root at the back, and a subtle hint of this root up in here. Just in this model, I am going to clear off some of this tissue just so we can have a better look at here. It's nice to kind of start in here. There we are. You see it's a very subtle change. This is very similar to your actual patient, so it is a very subtle color change. And hopefully you can see that with this is I've cleared the bone off of this part of the root, and there's a very, very subtle change. It's more beigey white than that pure white, and same at the back. So, and then we have this white in this middle section here, so we can see our root is here on this side, bifurcation, and the bone up to the bifurcation here, and then this more rostral root, which is quite a bit bigger. So we're gonna take our round burr off. And we're gonna replace it with a taper burr. And this is what we're gonna use to section. All right, so we can do a couple things. So you like to follow in that angle here, and then we'll do that over here as well. We might as well. So this is the double kind of sectioning of the tooth. Once you get more experience, what you can do, so this is going right in that plane, so you're gonna have much better access to that root. There we go. And then same over here, we're gonna go line that up with the angle of that root. And then what you end up doing is removing this kind of triangular section. The other option, and once you get a little bit more experience, is you're just gonna make one cut and you're gonna go right through that middle. And that's what a little bit. Now the one thing I wanna do is I wanna make sure on my opposite side I've gone all the way through, which I have not done. So I'm gonna continue to get in there. You really wanna make sure that you've separated. And the bifurcation, you want to make sure this is a big tooth. You want to make sure you go all the way across. Obviously, when you're patient, you're not really going to be able to flip them the way I am, but you are going to want to make sure that you are getting that lingual aspect and sectioned all the way across. And then the other thing is the bifurcation often goes quite a bit below that gum line. So you want to make sure, especially if you're just doing one cut, that you're getting right below the gum line. Other thing I like to do is I like to kind of go into that periodontal space and then just with my burr and make it a little bit more pronounced. Certainly you want to make sure that you're not getting anywhere near the roots of that tooth beside you, but this just allows you to maybe secure, especially with the surgical extraction, secure in your elevators a little bit better into those spaces. This one I haven't done at the front. There we go. You can kind of just imagine just making a little bit of space in there to place an elevator. All right. So I'm pretty happy with my sectioning. This piece will just kind of fall out. Now, what you like to do is take your elevator. I like to start at this cranial aspect because I feel like I can get good purchase. And you can kind of wiggle it into that area. And I wiggle it in here into that space, and then I hold. And we hold. And I'll kind of try and get over into this space here, and we hold, and we hold. And I'm just kind of see how I've got that little area in there. Can actually remove way more buccal bone than you think. You can remove, sometimes you have to. If you've broken a root, which I'll show you in another video, you can remove a tremendous amount of buccal bone. It does create a weakening, especially in these really major teeth on the lower jaw. Removing this tooth and the lower O4s, lower canines, they compromise about 50% of the bone strength in these areas. So that's why it's really important in your post-op instructions that you're going to tell these owners no chewing, nothing hard in that dog's mouth. And it's really going to take a full 6 to 8 weeks. It's basically the same amount of time as a fracture. That's about the amount of time that it takes this bone to heal. After you've extracted this tooth, this socket is going to fill up with blood, and then over the next several weeks that blood is going to form a clot, and then those chondroblasts are going to come in, and then your fibroblasts and all that healing stuff is going to come in, and over time they're going to transform this from a socket full of blood into actually solid bone. So if you do your cohat on this dog in a year and you take those dental x-rays, you're going to find, so I'm just going to switch out my elevator. I'm going to see if I can put a little bit larger one just to see if I can get a better purchase, and that's what I do sometimes is I switch back and forth. But yeah, like I was saying, if you do a cohat on this patient in a year from now, and you do those x-rays, you're going to find that that area has just filled in with solid bone, which is great. So you've taken out a diseased tooth that was causing pain in the mouth, and then in a fairly short period of time, that mouth is going to be pain-free. But this is definitely one of the harder teeth to extract. It takes time, especially whenever it's like quote-unquote healthy like this. And essentially you're just kind of going back and forth. I'm not getting a ton of motion on this tooth, so sometimes what I'll do is if I'm not happy with the amount of motion I'm getting on my tooth, I go back and I remove some more of that buccal bone. And that's what I'm going to do in this case, because I'm not super happy with the how this is going. So I'm going to make it a little bit easier on myself as well as my patient, and see if I can't get this. So I'm just, again, you can see, just painting across, clearing this root of some bone, and going and digging down a little bit on either side just to help me get some leverage. Like I said, this is a big root. Alrighty, let's see if we can't get our instrument into this area. I took a little pause just because I figured you didn't want to watch me too much. So now I'm just kind of going around. I'm going that little piece of crown that we kind of sectioned off that kind of fell out. I will go around to this inner surface, and I'll just go either way, get some purchase, and hold. And again, all we're doing is really weakening, and then we're going to go the other way. Really weakening all those little ligaments so that they are not holding this in place. And then we're starting to get a little bit more motion. Again, I find I always get a nice amount of purchase in this rostral aspect, the tooth. So I'm just going to do that, see if we can't. All right, I'm going to pause it and do a little bit more elevating, but again, I'm putting my elevator, and I may switch back and forth with a bit of a larger one and just get that in there. Go back to a smaller one. Of course, I'm going to hold it a little bit longer. What they say is sing happy birthday. As I get a little bit further down, I may take a really small one, just getting that in and seeing if that is going to help in terms of me getting some leverage in there. So yeah, I usually go in between my elevator, especially a big tooth that kind of tapers as it goes down. I may use 3, maybe even 4 different size elevators, just because it's going to be much wider at the top, and what you're looking is to have your elevator really hug that curvature of that root, and that's what's going to get you leverage. All right, so I'll work a little bit more. I won't bore you, you probably already are, and come back whenever this is ready to come out. All right, welcome back. I've just been working a little bit more on this 09, and don't get discouraged. These are, especially the healthy ones, these are roots that are big and are gonna take some time for you to get them out. Now, sometimes I get to a point where I'm struggling a little bit with actually getting some purchase on the root. So I'm not getting really a ton of purchase. So use this with caution. You have to be very, very careful, but I will pick up my extraction forceps. And what I'll do is I'll get a good grip, and I will do a rotation. A quarter turn, no more, and you don't force it. And I will go and I'll hold. I'll rotate slightly, that quarter turn, just as if it was an elevator, and I will hold it in that position. So I'm not putting, I don't want to put too much torque, because if you put too much torque on a long skinny thing, it's going to break. And I'm going to go back, and then, oh, I've got, I'm going to do a little bit more. A little bit more. And I'm just, essentially we're working our way from the gum line down to the base of that root, really trying to break all those ligaments until we get enough broken. So I'm just gonna see if I can't get my elevator. I'm gonna push it down, see if I can. Oh, this is promising. Oh yeah, I like this. All right, I think I've gotten it pretty loose. I'm gonna pick up my extraction forceps, and oh yeah, I like what I'm seeing here. We've got like that little root. Woohoo, we didn't break the root. That's, so you have to be patient, take your time. You break the root, you've actually are just making your job that much harder. So just in dentals, just take your time. And then now we start right back over with that caudal root. Lucky us. All right, I'll leave it here, but essentially same situation, getting into either side and just giving some elevation. And there we go. And then a hold. Got some purchase, give it a hold. And that's all you do. A lot of rinsing and repeating.